Hello. In this video, we are going to look into the pathophysiology of the alcoholic liver disease. Normally, the alcohol will cause first fatty liver. Fatty liver means the deposition of the fat droplets within the hepatocytes. First, it will be the 1/3 and it occupies 2/3 of the hepatocyte, and at one point it will totally filled with the hepatocyte is filled. That is called ballooning, filled with the fat droplets. This will go for degeneration. That's called ballooning degeneration, and it will act as the foreign body, then inflammation process. Once inflammation sets in within the fatty liver, that is known as steatohepatitis, alcoholic steatohepatitis, because if alcohol causes the fatty liver and the steatohepatitis is called alcoholic steatohepatitis. Same kind of the steatohepatitis can occur in non-alcohol also. So in the it's mostly we are seeing the diabetic individual, that is called non-alcoholic steatohepatitis. Whether it is alcoholic hepatitis or the non-alcoholic steatohepatitis, that inflammation will go for the fibrosis, that's called death scar formations, death cells, and the fibrosis will turn into the cirrhosis. Cirrhosis means the fibrosis with regenerative nodule. So normally within the fibrotic structure, the viable hepatocyte will be there. That will go for hyperplasia, hypertrophy. It to compensate the liver at one point will look like a regenerative nodule. This regenerative nodule, some of the individual, in alcoholic almost 4% of the individual, it goes to dysplasia and metaplasia and cancer formation. So this is the sequence of the pathophysiology. Alcohol consumption, first fatty liver, then steatohepatitis, fibrosis, cirrhosis, and hepatocellular carcinoma. At what dose or beyond what dose this alcohol will cause liver injury? So that's why the standard drink came into the picture. In adult male, beyond 2 standard drinks per day, it will cause liver problem. In female gender, beyond 1 standard drink will cause the liver damage. The 1 standard drink means 10 gram of alcohol. If a male gender, if they are consuming more than 20 gram of alcohol per day, will lead to alcohol related liver disease. In female gender, consumes more than 10 gram or a 1 standard drink will lead to alcohol related liver problem. Having said that, we have to know if the concerned either male or female already they have some other liver related problem. For example, if they have a hepatitis B virus or hepatitis C virus, or if they have the diabetes related fatty liver or the hypothyroidism related fatty liver, that point this standard drink is not, the rule of this standard drink is not applicable, because even if they consume less than 1 standard drink alcohol in female gender, they will get liver problem. So it is a synergetic action. Similarly, in male gender, if they have diabetes, if they are consuming alcohol, that time the rule will not be applicable. So here I have shown the different alcohol beverages. So what about the standard drink? If you take a beer, it shows the 330 ml and beyond. So 330 ml comes as a 1 standard drink, and beyond that it is called the more than 1 standard drink. Similarly, all the concentration based the beverages I have depicted. The alcohol once enters into the hepatocyte, it will get metabolized first within the cytoplasm. So hepatocyte, just imagine hepatocyte has the nucleus. So within the cytoplasm, the cytosol, it contains the enzymes called alcohol dehydrogenase. This metabolizes 70% of the alcohol and it converts into the acetaldehyde. In the cytoplasm, there are other structures, endoplasmic reticulum. The cytochrome P450-2E1, that plays the major role for metabolism. And in the same cytoplasm we have the peroxisome. That peroxisome contains the catalysis enzymes. that also metabolizes the alcohol. So once the alcohol molecules enter within the hepatocytes, the cytosolic alcohol dehydrogenase, then endoplasmic reticulum cytochrome P452E1, then peroxisomes the enzyme catalyze. These all plays the role for the metabolism. It's producing the acetaldehyde. This acetaldehyde is the toxin. Why I am telling toxin? This acetaldehyde will bind with the protein molecule, it will bind with the fat molecules, it will bind with the nucleic acids. So the hepatocytes will do lot of the carbohydrate metabolism, protein metabolism, fat metabolism. If this derange, the nucleic acid will help for the all electrons transport. So this acetaldehyde will destroy the routine function of the hepatocytes. This acetaldehyde, the three-way it's formed, cytosol, endoplasmic, peroxisome. Then it is taken up by the mitochondria also within the cytoplasm. The mitochondria, it detoxifies the acetaldehyde into the acetate and the water and the carbon dioxide molecule due to the enzyme called acetaldehyde dehydrogenase. So that's why the alcoholic people, sometimes we can say, the microscopically, the pathologist will tell it's a mega mitochondria. So due to the beyond the limit, if it is there working, it will go to mega adaptation. It is mega mitochondria. And even in the fatty liver wise, we can see the fat droplets, ballooning, degeneration, inflammation, everything. So these all formulated because of the acetaldehyde formation. Here I have mentioned how the alcohol, not only the routine metabolism, it is increases the free radicals. If you see the slide, the chronic alcohol consumption, it affects the superoxide dismutase enzyme, catalase enzymes. So we know all the enzymes are important to degrade the free radicals. If the particular enzyme functions or affected by the alcohol consumption, then there will cause excessive release of free radicals. These free radicals is one of the main cause of the ongoing inflammation. Here, slightly I am going in a little bit detail. Acetaldehyde not only binds with the protein, fat, nucleic acids, and also it will enter into the nucleus of the hepatocytes. And once it's entered, this acetaldehyde changes the transcription factor that's called ERP1, which is important for the steatosis control. It changes the transcription factor of the particular gene. So this also induces the steatosis formation genetically. That means the acetaldehyde, it is changing the entire hepatocyte, that means the nucleus of the hepatocyte, to produce the more and more steatosis. So that's why the chronic alcohol consumption will cause the fatty liver, and the fatty liver related all other consequences. This slide shows the alcohol consumption not only affects the liver, alcohol has the direct action in the enterocyte, the gut mucosal. It increasing the bacterial translocation. So the increase in the bacterial translocation, we know this all carried by through the portal venous circulation, and it comes to the liver. Liver is the large reticuloendothelial system in our body. It contains the macrophage that's called modified Kupffer cells. So that will try to react, and it releasing the more and more pro-inflammatory mediators. In other end, from the adipocytes, alcohol has direct act on the adipocyte. That's why obesity people, if they have the alcohol drink, so that related the liver damage will be more. So alcohol directly affects the liver. Indirectly, it is increasing the bacterial translocation, and it increases that from through adipocyte into the DAMPs. DAMPs mean damage associated molecular protein. So in nutshell, all this component increases the pro-inflammatory markers. Whenever the pro-inflammatory markers are increased, the consequences will come to the scar formation. Thank you so much.